You're watching Wellness Wednesday with Damon K. Jones. Powered by Black Westchester Magazine. It's the news with the black point of view. Let's make health and wellness the new black.
Welcome to Wellness Wednesdays, where we bring truth, healing, and clarity to black health. Today, we're breaking down a significant move that could transform access to life-saving medicine in our community. President Trump signed a new executive order aimed at lowering drug prices. And while it's getting buried in politics, we're unpacking how it could directly impact Black America's health and wealth.
Here, our leader in the Senate, John Thune, Mike Johnson, spoke to both of them. I said, when you score, you're going to have to score two things. You're going to have to, number one, score that hundreds of billions of dollars of tariff money is coming in. But even bigger than that, you're going to have to score that your cost for Medicaid and Medicare and just basically pharmaceuticals and drugs is going down at a level that nobody has ever seen before.
Let's talk real for a second. We lead the nation in chronic disease, diabetes, hypertension, asthma, cancer, you name it, we're carrying the weight. Black adults are 60% more likely to be diagnosed with diabetes. More than half of us have high blood pressure. And black children, they're 5 times more likely to be hospitalized for asthma. Now add this to the picture. We spend more than $35 billion a year on prescription drugs, often in neighborhoods with few pharmacies, little access, and high costs. This isn't just a health issue, it's an economic one. We're being overcharged, underdiagnosed, and overlooked. President Trump's executive order employs a most favored nation model. Translation? It tells Big Pharma, you can't charge Medicare and Medicaid programs our elders rely on more than you charge countries like Canada or Germany. Think about that.
So today Americans spend 70% more for prescription drugs than we spent in the year 2000. Think of that. Our country has the highest drug prices anywhere in the world by sometimes a factor of 5, 6, 7, 8 times. It's not like they're slightly higher. They're 6, 7, 8 times. There are even cases of 10 times higher. So that you go 10 times more expensive for the same drug, that's big numbers. Even though the United States is home to only 4% of the world's population, pharmaceutical companies make more than 2/3 of their profits in America. So think of that. With 4% of the population, the pharmaceutical companies make most of their money, most of their profits from America. That's not a good thing. Now, I think, by the way, I have great respect for these companies and for the people that run them. I really do. And I think they did one of the greatest jobs in history for their company, convincing people for many years that this was a fair system.
We've been paying 2 to 4 times more than other countries for the same drugs. That's not a healthcare system. That's a hustle. Dr. Oz said it plainly.
That regulates a negotiation process. This is the best price that was able to be obtained by the Biden administration. And if you look at these numbers, they actually reflect how much on top of the most favored nation price was being paid by the United States. So the closest to me, and Bob, you can point to the Jardiance, the closest one, 289%, the one that's closest to you. That means that we are paying in America 4 times more than that drug costs in other countries. Again, 100% is the baseline. It's 289% above that baseline. It goes all the way down to when we're paying 50% more than any other country. That's the range. As was pointed out by President Trump, half the time we're paying 3 times more than is paid in other countries.
We are paying in America 4 times more than that drug costs in other countries. Half the time we're paying 3 times more. It doesn't make any sense for the system. And Robert F. Kennedy Jr. laid it bare.
We have 4.2% of the world's population. Our country represents 75% of the revenues for pharmaceutical companies. We spend in our country $1,126 per capita on drugs. In Britain, they spend about $240. They spend 1/5 of what we do. And this is true across Europe. And the drug companies, Europeans, if you ask them, it made no sense what they were saying. America has to pay for this innovation or it's not going to happen. President Trump is saying to our European partners, is you got to raise the amount that you're paying for those drugs and pay for your share of the innovation.
There's at least one pharmaceutical lobbyist for every congressman and senator. The industry spends 3 times more on lobbying than any other sector. Now, let's be honest for a second. Love him or hate him, Trump made a move the system's been afraid to make for decades. Here on Wellness Wednesdays, we often say it. Wellness is wealth, and high drug costs are a tax on our healing. This executive order has the power to drop medication prices by up to 80%. That's money staying in our pockets. That's insulin refills not getting skipped. That's blood pressure meds not being rationed. This is about more than politics. This is about the price of staying alive. Let's be real. Big Pharma isn't going down without a fight. They're already filing lawsuits. They're already buying off politicians, just like they always have. For years, our community has supported leaders who claim to be fighting for healthcare reform. But prices kept rising. Access kept shrinking. This time, we have to watch the outcome, not the noise. If this order withstands legal challenges, it will save lives in our community. And if it gets blocked, we'll know exactly who stood in the way. So what can you do? Stay informed. Don't let social media headlines distract you from the facts. Hold your leaders accountable. Ask your local reps, are you supporting policies that cut drug prices or protecting pharma profits? Share this video. Help your elders, your neighbors, and your church family understand what's at stake. And remember, wellness isn't just about herbs and smoothies. It's about policy. It's about power. It's about the systems that decide who lives and who struggles. Every Wednesday, we bring you truth to heal, not just hope. This isn't about worshiping politicians. It's about defending our community's right to live well, age strong, and be free from medical debt. We've waited too long. Now something is finally on the table that could change the game. Please don't sleep on it, because talk is cheap. But your health, that's priceless. Have a blacktastic day. And remember, God is in your vegetables. If you found this video informative, don't forget to like and share it with others who need to hear the truth. And for exclusive content and behind-the-scenes access, join the Black Westchester Magazine YouTube membership club today. Your support helps us keep independent Black media strong. Support independent Black media with style. Rock Black Westchester merch and represent the news with the Black point of view. Every purchase helps us speak truth to power.
Thanks for tuning in to Wellness Wednesday with Damon K. Jones, brought to you by Black Westchester Magazine. Remember, the information shared is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your healthcare provider before making any changes to your health routine. Stay informed, stay empowered, stay well.